Now, concerns continue to be raised in the medical community that some children questioning their gender are being encouraged to transition too early, before they've been properly assessed. Last month, England's National Health Service announced it was closing the UK's only gender clinic, Tavistock, after a review found doctors felt pressured to adopt an unquestioning approach to children confused about their gender identity. It's an issue that's reared its head here too, as the Weekend Australian reported a 26-year-old man who transitioned to a woman and then back again has been left infertile from the effects of oestrogen on his body. Ollie Davies told the paper, "Everyone I knew put trans people on a pedestal. It was fashionable. I knew it would be celebrated and promoted. At first it was euphoric. I felt like coming out as trans was my coming home and the key to everything that was wrong in my life." And in a separate case, the Sydney Morning Herald reports today a Sydney woman is suing her psychiatrist for professional negligence after having her breasts and womb removed at the age of 22. Let's bring in Claire Chandler, Liberal Senator for Tasmania. Thanks for joining us, Claire. Look, these are sensitive issues and some people get very, very angry when they are raised. But if people are making these decisions, having life-altering surgery and then regretting it, something's going drastically wrong, surely.
Oh, of course, Chris, and thank you once again for having me on the show to talk about such an important issue. There are some real questions that need to be answered about the way that kids and young Australians are getting treated for gender dysphoria. We know that the numbers of young Australians seeking treatment are going through the roof, and I think it's only fair to expect that when those numbers are exponentially increasing, then so too are the numbers of people who are going through these life-altering treatments and then at some point later down the road regretting those treatments. So some serious questions that need to be answered here. And it's a matter of regret that gender clinics in this country have not heeded the advice of what's been occurring with independent reviews in other jurisdictions to come to some sort of more common sense approach and just be more transparent about the types of treatments that they're providing children.
You know, in both these cases, from what the individuals have said publicly, they were depressed, they were concerned, they were confused, and that's understandable, and they need support. Obviously, they don't want to be any sort of ostracisation. They need support through this, but they're both effectively saying that they're encouraged down this path, changing gender as a solution, and obviously for them it hasn't worked out. Did you have any idea in percentage terms how often you get this case of regret and desperation for reversal?
Well, it's not actually a number that we know, Chris, because, like I said, gender clinics haven't been upfront about the number of patients they're treating or indeed the pathways that those patients are going down, whether or not 5, 10, 15, 20 years down the track they're regretting those surgeries. But sadly, like you say, we are starting to hear more and more of these stories of young people who have undergone life-altering surgery to transition and regretting those decisions later on in life. So it's really upsetting, and I can understand why many of your viewers watching the show tonight would feel exactly the same way.
Yeah, it's distressing to read about how these people are caught up in some sort of peer group pressure. This happens at a time when government agencies and other institutions are really trying to get rid of gender from our language and from our bathroom choices and the like, and people shout out about biological sex being a factor in women's sports and the like. I mean, as a society, don't we need to celebrate gender, the difference between the sexes, not pretend it away? Isn't it healthy to understand that?
Oh, look, it's those issues, Chris, are ones that I don't like to conflate into one huge problem. I think that they can all be dealt with differently.
But don't you think they're related? There's a context here where people want to pretend gender away as if it's biologically insignificant, when of course it's biologically incredibly significant.
Certainly. And I think the broader denial of what our biological reality is and the difference between men and women and all of these sorts of things are of very big concern, but also of great concern to me is ensuring that our young Australians are provided with a fulsome, holistic, comprehensive model of care when they are dealing with very serious issues like gender dysphoria. And I don't think that means automatically choosing to provide children with cross-sex hormones or serious life-altering surgery like a hysterectomy or a mastectomy. What it means is providing these young people with the support to understand why they're feeling that way and explore other options to see if there are ways that will solve their issues and their feelings and their concerns without setting them on a life-changing path.
Yeah, now this is largely a state issue, presumably. It's about the state health systems and how they operate. As a senator involved in the federal administration, what do you think that federal parliament can do? Well,
look, I think first and foremost, Chris, like I said at the start of our interview, the gender clinics need to be more upfront and provide the data so that all Australians, but particularly state-based health departments, can scrutinise it and determine whether or not the treatment pathway or the treatment processes and the pathways of their patients are appropriate. But we can also look at examples in the United Kingdom where they've recently undertaken an independent review by a health professional of their gender clinics to come up with some concerns and suggestions and a new model of care. So lots of things that can be done in this space, and I'll certainly be looking very carefully at this over the next little while to see what can be done at any level of government to improve outcomes for our young Australians. Yeah, well, good on you, Senator, for shining a light on it, because I know it isn't easy, and transparency is pretty important here. Thanks for your time.